Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
Well, thank you for being with us today. My name is Rana McKay, and I'm a GU medical oncologist at the University of California in San Diego. And glad to be talking to you about prostate cancer and prostate cancer screening and the importance of early detection. Prostate cancer is actually the most common cancer among men in the United States, and it's actually the second leading cause of cancer death in the US. We know that prostate cancer is a common cancer, and it's actually twice as likely to come on in African American men and men of non-white race. And, prostate cancer screening is really important. I know there can be some confusion around the recommendations for screening, but for those patients that are, white men aged 45 to 75, discussing the benefits of prostate cancer screening with your clinician is super important. Actually, the age for screening is even lower for African American men from age 40 to 75. And, usually prostate cancer screening is done via a simple blood test. And sometimes patients may require a biopsy or an MRI to detect prostate cancer. And the prostate cancer treatment, it's not a one-size-fits-all model for everybody. It really changes based off of a patient's risk. And there are some prostate cancers that don't need to be treated. But certainly if somebody has a higher risk cancer, those are the ones that have the potential to impact somebody's life expectancy, in which case there's a huge benefit to screening with regards to benefits from a treatment and mortality standpoint for those high-risk patients. So critically important to talk about screening with your clinician, with your primary care doctor. The conversation starts there, discussing sort of the pros and cons of treatment. As I said, it's a simple blood test, and sometimes there is a rectal exam that's also performed to assess for nodularity within the prostate. I think the benefits of screening include early detection, detection prior to development of metastatic disease, and potential life prolongation. And then the cons of screening, of course, are, sometimes there can be anxiety associated with cancer detection. There can be, additional diagnostic tests that get performed. And as I stated, there are some prostate cancers that really don't need to be treated at all. And being prudent when things are getting detected to identify those that are low risk that don't need treatment, but those that are high risk that do warrant treatment. So at the end of the day, it's critically important for each of you to talk to your primary care physicians and potentially urologists about the benefit of prostate cancer screening, this is certainly a leading health matter in the United States. Thank you for joining us today.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelexis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.